Hello, my name is Harisana from Group 5 and I'll be presenting our topic which is oral hygiene. The practice of keeping our mouths clean and disease-free is known as oral hygiene. Oral hygiene is a type of preventive care that can help prevent cavities, bad breath, gum disease and other oral health problems. It entails brushing, flossing and going to the dentist on a regular basis. Oral health is as important as overall health. According to the World Health Organization, it is estimated that oral disease affect nearly 3.5 billion people all around the world. Our mouth, which is the entry point to our digestive system, is full of bacteria, and some of it can cause disease. A bacterial infection in our mouth, for example, can be carried by our bloodstream to other parts of our body that may contribute to various diseases and conditions such as endocarditis, cardiovascular disease, and pregnancy or birth complications. Bacteria are normally kept under control by the body's natural resistance and good oral health care, such as daily brushing and flossing. However, without proper oral hygiene, bacteria levels can rise to the point where they can cause oral infections such as tooth decay and gum disease. Good oral hygiene allows you to enjoy life more. It allows you to speak clearly, taste, chew, and swallow delicious and nutritious food, and express yourself through facial expressions such as smiling and laughing. In conclusion, keeping our teeth and gums healthy is an important part of a long-lasting overall health.
Hi, I am Nurhan Zakaria. So before we go further into this topic of oral hygiene, do you know that oral hygiene is vital to an individual overall health and well-being? A study have shown that untreated oral disease may increase the risk of adverse health condition. So perhaps do you know that? Are you aware of it? Now that you are aware of what oral hygiene may do to an individual, I will continue with the benefits of keeping good oral hygiene practices. Firstly, you will have healthier teeth and gum. Why? Because through good oral hygiene practices, it will reduce tooth decay and sensitivity. Next, fresher breath. Brushing and gargling regularly will ensure your mouth to smell fresher. Thirdly, reduce the need for dental work. As we all know, going to the dentist will cost you money. Hence, keeping good oral practices will reduce the number of times you have to go to the dentist for any dental work. Fourth, lower risk of disease, stroke, diabetes, and etc. So you may wonder what is the connection of oral hygiene with these diseases stated. Just like what I've told you in the beginning, oral hygiene do relate with overall health, as our mouth is the entry point to our digestive system and respiratory tracts. Just like any other area of our body, our mouth is full of bacteria, but mostly harmless. But hear me out. Some of these bacteria may still cause diseases. Lastly, good oral hygiene practices will ensure you with more confidence when communicating, as you won't have to worry about your teeth condition, whether the smell or if there might be any food stuck between your teeth.
So, I would like to share about the effects of poor oral hygiene and their factors leading to the disease. There are three main effects or disease that will occur if a person does not take care of their oral hygiene. The first one is dental caries or tooth decay. The second one is periodontal gum disease. And the last one is oral cancer. For the first one, dental caries result when plaque forms on the surface of a tooth and converts the free sugar contained in foods and drinks into acid that destroy the tooth over time. A continued high intake of free sugars, inadequate exposure to fluoride, and a lack of removal of plaque by toothbrushing can lead to caries, pain, and sometimes tooth loss and infection. And for the second one, periodontal gum disease affects the tissues that both surround and support the teeth. The disease is characterized by bleeding or swollen gum, gingivitis, pain, and sometimes bad breath. In its more severe form, the gum can come away from the tooth and supporting bone, causing teeth to become loose and sometimes fall out. Severe periodontal disease are estimated to affect around 90% of the global adult population, representing more than 1 billion cases worldwide. The main risk factors for periodontal disease are poor oral hygiene and tobacco use. And for the last one, which is oral cancer, includes cancer of the lip, other parts of the mouth, and the oropharynx, and combined rank as the 13th most common cancer worldwide. Oral cancer is more common in men and in older people, more deadly in men compared to women, and it varies strongly by socio-economic circumstance. Tobacco, alcohol, and areca nut use are among the leading causes of oral cancer.
Next, I will explain ways on how we can protect our teeth from serious oral diseases that may develop as a result of poor oral hygiene. By carrying out a proper oral hygiene practices, we can protect our teeth and making them stronger, thus ensuring a healthy and beautiful smile at all times. First and foremost, a good oral hygiene starts with brushing our teeth at least twice a day. Be sure to follow the proper brushing technique, not just brushing the teeth, as bacteria can also attack the gums and other supporting tooth structure as well. Using extra oral hygiene products are also important, but very few people actually practicing it frequently enough. For example, flossing and using mouthwash. It may not be entirely necessary to floss and use mouthwash after every meal, but doing so at least once a day can help to protect our teeth in the areas that cannot be reached through brushing, such as in the very back of the mouth. Next, we should avoid harmful foods and drinks. Many instances of tooth decay can be largely attributed to a poor diet, which consists of foods high in sugar and other harmful carbohydrates. If you want to protect our teeth to the fullest extent, try to avoid too much intake of harmful foods and drinks, such as sweets, soft drinks, and junk foods. Of course, giving up this diet is not feasible for everyone, which in this case, extra hygiene practices is required after consumption. Last but not least, it is very important to visit the dentist on a regular basis. There is still a chance for plaque to build up on the surface of our teeth, even though a proper oral hygiene was practiced. By visiting the dentist for a dental cleaning and checkup regularly, our teeth will be protected from any plaque, thus ensuring a good oral hygiene. Dentists itself recommended that we should visit them for a regular checkup at least twice a year.
Assalamualaikum and hi, my name is Dorzalika and tonight's part that I'm going to share is oral hygiene practice. So how can we protect our oral health? To protect our oral health, we must practice good oral hygiene daily. First, brush your teeth for 2 minutes each time, at least twice a day. And second, floss daily. Third, we can use a mouthwash to remove food particles that have remained after brushing and flossing. Then, we can eat a healthy diet and limit sugary food and drinks. And lastly, schedule regular dental checkup and cleaning.
Hi everyone, my name is Muhammad Sulhi bin Ahmad Tajuddin and I will continue about the benefits of good oral hygiene. Hi everyone. One of the benefits of taking good care of oral hygiene is it reduces the likelihood of tooth decay. One of the benefits of daily care of teeth and gums is the prevention of cavities. With brushing and the use of other oral hygiene accessories, such as dental floss or interdental brushes and the mouthwash, food debris is removed after each meal, limiting the growth and development of bacteria responsible for the formation of one of the benefits of taking good care of oral. Moving on to point number 2. If we take good care of oral hygiene, it prevents us from having bad breath. So bad breath is medically called halitosis. It can result from poor dental health habits and may be a sign of other health problems. Bad breath can also be made worse by the types of foods that we eat and other unhealthy lifestyle habits. We can take steps to prevent and treat bad breath at home and with the help of your dentist or doctor. So a good sign of a healthy mouth is not having bad breath. Bad breath is largely caused by the action of bacteria that feeds on food debris and gradually damage other tissues in the oral cavity. Point number 3 if we take good care of our oral hygiene, it improves our overall health. So without proper oral hygiene, bacteria can reach levels that might lead to oral infections such as tooth decay and gum disease. So it is scientifically proven that oral health is closely related to the health of the whole organism. Good oral hygiene not only prevents common diseases of the teeth and gums, but also reduces the risk of cardiovascular disease, heart attacks, stroke, and promotes healthier fertility. Point number 3, if we take good care of our oral hygiene.
Assalamualaikum and hi, my name is Marsha Fakira binti Muhammad Farid, and I'm going to share the analysis that has been made from the data that we have collected through a survey on the awareness of oral hygiene among people regardless of age. The survey was divided into several sections, which the first section is on demographic of respondent. In this section, we asked the gender of respondent, their age, and also their status, whether they are a student, working, or unemployed. A total number of 100 respondents has answered this survey, which consists of 52% of male respondents and 48% of female respondents. The majority of respondents answered this survey are students with a percentage of 65%. The next section is on oral hygiene practices. Basically, in this section, we ask about how frequent the respondent brushes their teeth, how frequent do they change their toothbrush, do they use extra oral hygiene products, do they attend their dentist checkups, and which traditional practices do they think are still relevant nowadays. What can be concluded is that the majority of respondents brushes their teeth once to twice a day, and they change their toothbrush every 3 months. They also include extra oral care in their routine, and the most common answers given is using mouthwash. Most of the respondents also think that sugi wood is still relevant to practice nowadays. Continue to the next section, which is on the factors and problems regarding oral hygiene. The question that we ask includes: do you smoke? Do you consume high sugary food in your daily diet? Do you drink high sugary beverage in your daily diet? Do you experience gum bleeding, and how bad does your breath smell? The analysis that can be made from this section is that most of the respondents are non-smokers, and they did not consume too much of high sugary food and drink high sugary beverage in their daily diet. This result can be seen that most of them did not experience any bad breath. However, there are few of them experiencing gum bleeding.
Assalamualaikum and hi, my name is Nur Alia Izzati binti Cik Awang, and I'm going to conclude for section D, awareness on oral hygiene. Our questions: oral hygiene is important to our health. Parents should teach their children about oral hygiene at a young age. School, university, college, workplace should promote about oral hygiene's benefits. Taking care of oral hygiene could boost our confidence and self-esteem. And most respondents agree to these questions. Respondents pick 3 and 4 times is the most frequent rinse mouth after meal to get rid of food debris. 77% respondents never share toothbrush with others. Section E is the last section, and this section should be answered by respondent aged 13 and above. For question: do you think it is worth it to invest in oral hygiene? 90% of respondents agree. 52.5% did not agree the usage of oral products could cause side effects. 57.5% agree COVID-19 affects our oral hygiene. Over 90% agree future technologies improve oral hygiene practice effectiveness. Less than 50% think that the product that they are using could cause issue to their health, safety and environment.
My name is Muhammad Syahmi bin Muhammad Salihin. I'm from class 3BNS. So I'm in the section 48 for English Development and Engagement. So for today's presentation, I will be presenting about how to spread the oral hygiene awareness to the people. So we have 3 ways to spread the awareness that consists in the next slide. Okay, now for the first one, we have to educate people about the tooth decay. So what is tooth decay? Also called cavities, occurs when the enamel, which is the outer layer of teeth, erodes. Bacteria in saliva forms plaque on teeth and stick to food particles. Both of these causes tooth decay. So we have 3 stages of decay, which is appear on the slide. Okay, for the second one is we must show them the consequences of poor dental care. So people need to see consequences of not taking care of their teeth in order to truly understand the importance of dental hygiene. Poor dental health can lead to a number of other health problems such as heart disease, stroke, and even diabetes. Additionally, bad oral hygiene can cause unhealthy teeth, gum disease, periodontitis, and can even make it difficult to eat. Okay, for the last one, for the awareness for oral hygiene is we also can use the information on how to properly brush our teeth. So we can also use the infographic that can teach people how to brush their teeth properly and how to choose the right brush. For example, the method for brushing your teeth that help you get the job done right. Brush at least morning and once before bed, so twice a day. So as referred to the attached image at the slide, we can know that the right way to brush our teeth. So that's all from me, and thank you.
So for interview finding, I will tell a little bit about Miss Iza Firzana experience. She's been working as dentist trainer around 4 years while further her study in Cairo, Egypt. So commonly, the patients she treated are young adults and children between the age 9 to 29 years old. According to her, within this development age, they are more prone to dental disease and problem. Also, they are more concerned about the appearance of teeth and sometimes comes because of agitating pain due to caries. During the interview session, Miss Iza Firzana tell us that our teeth as their own shade. The perfectly white teeth that we see in fashion magazine and other commercial are not real. Having teeth that are completely white is impossible and also it's look weird. And she said to us that dental experts say there are 4 families of color of your teeth. First is Auburn family, which is red and brown. The second one is yellow and red family. This color is popular among Asian, especially Malaysian. So the third one is the grey family. And finally, the grey and red family. Also, during the interview session, Miss Farzana tell us about toothbrush alternative. So she recommend us to use soft bristle toothbrush because too much pressure or overbrushing can negatively impact the enamel and gums. If you tend to push harder against your teeth, more pressure does not equal cleaner teeth, and in fact can cause gum loss, which can contribute to teeth sensitivity, and it may start to damage the enamel and tissue around the teeth. So she said that the softer the toothbrush, the better for you to use.
Thank you, Diana, for sharing. Hello, everyone. My name is Alia Afrika, and I'm going to continue for the most common treatment by Miss Iza. Based on her experience, she had encountered a lot of patients needing for root canal treatment, or also known as pulpectomy. According to her, it is better for us to prevent than getting treatment, as this treatment can be a bit pricey. It all started from a very simple caries. Later, that will affect the tooth pulp, which is the inside of the tooth, and the tooth will experience that tooth.
So, based on our interview, Miss Iza told us that one of the bad habits is chewing ice cube. She said that ice cubes should not be chewed. Although our teeth are among the tougher bone in our bodies, munching ice cubes can cause them to crack. So, it will result in tooth sensitivity. So, how can we increase awareness? According to Miss Iza, parents play a big role. An early exposure from the parents is important as they can teach their kids on how to brush their teeth properly and encourage them to have a healthy lifestyle eating. Next, from the dentist effort. Nowadays, a lot of dentists become influencers to spread awareness and debunk myths about oral hygiene. It is proven a good method to educate the public. So that is all from me. Thank you.
Hi, this is my last topic in our video is conclusion. So, you have listened what my friend explained earlier about oral care, right? So you all must have got lot of information from our video, and also you can apply in your daily life after this. So, with this opportunity, we want to tell you that there are actually many ways that you can beautify or make your mouth healthier. So, other than that, you also need to know that product or method that can damage your mouth if you choose the wrong way in your oral care. In terms of the information that we get in our Google form, that in that respondent, that their answer, there are very many different answers that we get. So for us, for our group, we don't care about our respondent answer. That's not mean that we don't care, like we just close this one eye. It's because we don't care that maybe other person that say that this is the wrong method that you use to make your mouth healthier. But we don't care because why? Because we think different person have different method and also perspective. So final word from me for all person out there, always keep your mouth in good condition, and also if you keep your mouth in a good condition, you could also can increase your own moral when dealing with other people. So you cannot be shy after this if you keep your mouth in healthy way. So I hope we can see in the next video. So I hope you guys in a good condition and always keep your mouth in a good way. So thank you for watching this video, and bye from me.